Hey, good morning, everybody. Lester Coutinho is supposed to be chairing this session, but unfortunately he's in Pakistan, and so we thought he could connect. It doesn't look like he's been able to. So I'll chair the session instead. Thanks very much for joining today's webinar. We have three short presentations, and then we'll have an open discussion around the topic. And we've called the topic Marketing for Youth. And the purpose of this, given that this is the MBA working group, is to try to encourage a different thinking around reaching youth and trying to address their certain mental health needs. Historically, many interventions to reach adolescents, particularly married adolescents, have focused on going through the health sector, through youth-friendly clinics, or through the education sector, through in-school education campaigns, and in some cases linking to services. Yet we know that in many situations, adolescents will access information and services through the private sector, particularly, for example, pharmacies or stores or other places where they can get information and contraceptives such as pills and condoms particularly. So we wanted to provide the opportunity to have a discussion around trying to look at ways in which commercial and non-for-profit sectors can enhance the role of a marketing approach. And we've got three brief presentations. The first one is from Jana Oberdorf. That will be followed by a presentation from Annabella Sanchez, who's the regional coordinator for Latin America from the DSI Deliver project. And then thirdly, we have Dr. Uwe Messiet, who's the founder of Action Health Incorporated, which is an NGO working in Nigeria. So we've asked them to give a brief talk for around 5 to 7 minutes. And there are some slides, I think certainly for the first presentation from Jana, and probably not from Annabella and Uwe. So if we can hand over, Jana, if you're ready, can you go ahead with your presentation, please? Huh? Could you unmute yourself and give your presentation?
Great. I've just been unmuted by the host. Can everybody hear me now?
Yes, we can hear you.
Great. Hi, everybody. I'm, as was mentioned, I'm Jana Oberdorf, the Director of Advocacy and Communication from Women Deliver. And I'm going to give you a very brief presentation on some of the work that we are doing to sort of increase knowledge, understanding, and getting young people involved in pushing for greater access to contraceptives. So this first slide, I just wanted to start, since I am the first speaker on this call, by just sort of flagging something that I think all of us know, but that young people really do face especially serious barriers in accessing this kind of information and services. And I think that's something that we all should just keep in the back of our minds as we think about marketing to young people. What are those barriers, whether it's, stigma, discrimination, or, financial barriers, just keeping in mind what young people are actually facing when they are trying to access these services. Next slide, please. So the campaign that we're running currently that's working to focus on these issues is called It Takes Two. And the concept is one of getting men and women, young men and young women, involved and invested in advocating for their own reproductive health, sexual and reproductive health, particularly in access to contraceptives. We have partnered with an organization called the Global Poverty Project to launch this campaign. And our first pilot project is being launched, or was launched, on March 8th in Uganda. The overall goal is to increase public support and awareness of family planning, and we're doing that through a variety of mechanisms. You'll see the website sort of snapshot here, but the overall concept is to get young people to take action in support of contraceptives through what we call gamified action. So having young people take an action, receive points for that action, accumulate points over time based on learning more about contraceptive options or writing their policymakers and things like that. And then being able to redeem those points for a reward that is appealing to young people. So oftentimes that will come in the form of free concert tickets, free football tickets, free airtime on their mobile phones, and those kinds of incentives for becoming active and aware about these issues. Next slide, please. So this is our launch in Uganda. You'll see we did a International Women's Day concert featuring Nyanda and Cindy, who are one international artist and one local artist from Uganda. And several other female artists performed. The entire concert had messages about contraception, about young people. There were booths and tents where young people could get more information from partners like Mari Stopes and others. And just building out this component of reaching young people basically where they are and through the information that they are using. So a lot of activity around the mobile phones, a lot of activity around social media, and again, leveraging the celebrity music component to get them interested in sharing about these issues. Next slide, please. And again, just pointing out that the real goal of this campaign is to target young people where they are, especially when it comes to urban youth, using mobile phone technology as a real linchpin of the campaign. And so far we have, just in that concert alone, 5,000 people signed up to the It Takes Two campaign in Uganda. And across the globe, 40,000 people signed up interested in taking action for family planning. Next slide, please. Great. And so the whole concept here is that if we make family planning more visible, it will create a public dialogue, it will reduce stigma, and it will increase demand among young people. And we really have a strong component here and a link, which is great for this group, to the FP 2020 commitments, focusing on countries who made commitments to FP 2020 and helping have this youth public support sort of hold their governments accountable for their commitments. And that will be my 5 minutes. I think last slide is just thank you for letting me share this information. I'm happy to answer any questions you may have. And that's our website if you want to find out a bit more information.
Great, thanks very much indeed, Jana. Before we go on to the next presentation, can we, if anyone has any particularly specific comments rather than general points, just for clarification, do they want to pose a question to Jana? And if not, we'll move on to Annabella's presentation.
Good morning. Can you hear me?
Yes.
Okay. I had some difficulties with the audio, but I'm glad I fixed it. Good morning, everyone. My presentation will talk about how the Deliver project has done some data analysis to identify unmet needs for family planning services and contraception among youth 15 to 24 years of age. Our objectives were first to respond to the need of the regional initiative countries that are basically Guatemala, Honduras, El Salvador, Nicaragua, Dominican Republic, Peru, and Paraguay. All these countries have had the opportunity to work on market segmentation analysis, but they all gathered in a meeting, and they always wanted to know what was the specific unmet need of this age group, but not only married women, but sexually active women. So back in 2012, we started by doing market segmentation analysis focused on this age group and analyzing all women, not only those that are married. The reason to do that was to specifically know what the unmet need of all youth were. Findings told us that since the denominator of this analysis was larger, of course, unmet need was higher. We also, the second step in the process was to share this information and these findings with technical people that have participated in the regional initiative, but also for the first time in our project, we invited selected youth leaders from all these countries so that they would start being exposed to this technical data, understand it, and how to use it to defend their sexual and reproductive rights. Specifically, to promote access, better access to contraception services among all youth. We have done around 3 workshops, and the purpose of these workshops have been to disseminate this data and to empower youth leaders from these 8 countries to use this data, to understand it. The first workshop was in Guatemala back in 2012. The second workshop was basically a training on data analysis, communication, and advocacy of selected youth leaders in these 8 countries. And that workshop told us that youth leaders, even though they have had several years being active in youth groups and promoting their reproductive rights, they really did not have the basic skills to use this technical data and to use it effectively in advocacy settings. So that was in 2013, in April 2013. Then the last workshop, we realized that we needed to focus our efforts in disseminating this data on how to engage more specifically the youth advocacy skills into promoting that Latin America strengthens their strategy on friendly services for youth. I don't know if some of you in the room are also working to promote youth services, friendly youth services. So that's where we are now, and we are in the process to do like the second generation of these announcements, and we're planning on engaging youth leaders right from the start. I have a presentation, and I would like to share it after this meeting. We have a lot of information on the outcome of each workshop, but since time is short, I will leave it. I don't know if I have more minutes, but I just wanted to say that as part of this support, the youth leaders of Latin America have gathered together in Facebook, and we are also in the process to help them connect with technical web pages and more information that will empower them more as the next generation of reproductive health advocacy leaders. So if you have any questions, just let me know. Thank you.
Thank you very much, Annabella. I was reminded last time that if you want to ask a question, if you can click on the raise hand button underneath the list of participants, then that would help that to go more smoothly. So, any immediate questions for Annabella? If so, please click on the raise hand button. Okay. Let's move along to the third presentation before we go to a group discussion. This is from Wen Esiet, who is calling in from Nigeria. And as I mentioned, is the founder of the Action Health Incorporated organization there. So, Wen, could you unmute yourself and talk to us, please? Thank you. Hello, we can't hear anything at the moment. Are you unmuted? Okay, it looks like we're not able to hear from Ulan, and so hopefully he'll be able to reconnect and speak to us then. So let's return to the first two presentations. We first heard from Jana, who presented an interesting idea from the Women Deliver group of trying to engage with youth through motivating them to a points with a redeemable point system to search out information and I think services to help address the needs and overcome their barriers. And she gave a specific example from Uganda where this is being tried out. We then heard from Annabella about using, first of all, undertaking a market segmentation analysis, and then using the data from that analysis and going through it, interpreting it with youth representatives and other program planners to identify what the issues are and how best they could be addressed. Two very different approaches, but two quite unusual approaches in this field. Does anyone have any thoughts about either of these approaches or any comments? Again, please click on the raise hand button.
I think I've raised my hand. Hello?
Okay, go ahead, Martha.
Okay, yes, so I think I did raise my hand. Hi, thank you. It's Martha Brady from the Population Council, and thank you both to the presenters. I just had two thoughts, and they're very interesting, as you said, in different approaches. I guess I have two points. One is that it seems to me that they're talking about sort of more advocacy roles, right? So how do you actually engage youth leaders, et cetera, in pushing family planning and the concept and normalize it, which I think is one good action. But that's quite different than how you would then structure the way in which you provide services or contraceptive services specifically. And there is where I think understanding the different kind of segments of, and I would call them adolescent girls and adolescent boys, or rather than this youth thing, because I think it homogenizes everything. But in any case, I think separating out advocacy roles and then service design and marketing products is actually quite different. So I just sort of think we should be clear about those two different kinds of things because the approaches to them are different. So. Ooh, it's terrible feedback here. Sorry. I'll.
Thanks.
No, I don't know if you can hear any of that.
Thoughts from others? I mean, I also had would like to ask for both Jana and Annabella. This is putting the researcher hat on. What are the outcomes you'll be looking for when you come to evaluate whether these approaches have been effective? What are your endpoints that you're looking for to achieve? So if either Jana or Annabella could address that, that'd be helpful.
Sure, I can address. This is Jana. So definitely, Martha is right on. Our campaign really is an advocacy focus. It has a goal of holding particularly in Uganda, the government accountable for their FP 2020 commitments, which currently they have met in terms of budgeting. But ensuring that the implementation is happening across the board, and trying to sort of raise the profile and awareness of family planning amongst young people. So certainly our campaign is focused on advocacy. In terms of outcomes, we are actually working with the several partners in Uganda with a specific focus supported by the government and UNSPA Uganda and others to implement and create policies that focus specifically on teen pregnancy. So a sort of outcome that we're looking for in the next year or so are specific policies that address the needs of teens who become pregnant, and then additionally to combat the high rates of teen pregnancy in Uganda. We are working with several partners who do service delivery, so Mars Stopes and others, to ensure that component is included, but it's not the sort of thrust of the campaign. It definitely is an advocacy campaign with links to services where needed, because of course we want people to be able to get the information and the actual services they need, after they learn about the issues. So I hope that helps a little bit to sort of frame what we're looking at.
This is Annabella. We are in the process to evaluate this intervention of first knowing where the adolescent ages 15 to 24 prepared to access contraceptives, and by understanding that, work with Ministry of Health and other service providers to improve access to contraceptives for youth. We, with USAID, Latino office, are in the process to gather this evaluation. I must say that we didn't focus on how our intervention has improved service delivery, because we are a regional initiative. We don't have that call, but we do want to understand how these market condition analysis focused on youth have made it more possible for the service providers in each country to coordinate better, to improve the service provision of Ministry of Health in particular, because they are the ones that are launching a huge improvement strategy of health friendly sites for youth. So I think even though it has an advocacy component as well, our intervention has really been based on our analysis of the market, where the youth prefer to go. And I really appreciate Martha's contribution, because clearly men are the ones that go more to the pharmacy, like young boys, and women prefer to go to Ministry of Health. But we haven't separated that analysis, and I think that's a very, very, it's a very good point. So what we're going to do is, if the group is interested, once we have the evaluation results, we could share with you. So I hope this explanation is useful. Thank you.
Thank you very much, Annabella and Jenna. Are there other comments or queries from callers on the line, or alternatively, is Uen there and able to speak yet?
Hello?
Hello?
Hi, yes, this is Judy Heichelheim from TSI.
Please go ahead, Judy. Yeah.
Okay. Yeah, I really appreciate both of the presentations, and Annabella in particular. I'm very excited to hear about the data that you guys have been working with, and I would very much like to see more detail. In particular, you mentioned, being able to look at it more closely by how boys versus girls access, but I think one of the other things that is incredibly useful for those that are engaged a bit more on the service delivery or the product delivery side is also by socioeconomic quintiles as well as the rural versus urban. Very interestingly, last week I was just at a presentation that was done by APT looking at the DHS surveys across globally across several countries, and they were presenting only women in union. So I'm excited to hear a different kind of analysis, particularly within our region. So I look very much forward to that. I think just one other comment or question about how the data is used. I mean, we hear a lot about youth-friendly services, and here we've been really criticizing or struggling ourselves to come up with what really is a comprehensive approach to youth-friendly, because this is, we've been trying to do this for years and years and years. But I think it goes back to that exactly. What are the young people saying about what makes it friendly for them? And how are we pulling that into our definition of youth-friendly services? And how do we provide a package or a more comprehensive approach in thinking there are some who rightly should be accessing in public sector, but as we see, like we said, lots of young boys like to go to pharmacies. There's probably young girls who prefer to go to private sector. We certainly see that within Latin America. I think sometimes there's a presumption they should all go to free services because they're youth, but I think that's something to understand more. And I'm curious if any of your data has started to capture any of that.
Yes, Judy, thank you for your comments. In fact, in the last workshop in El Salvador, back in November last year, people, some of the technical experts and from Familia Colombia, who is one of the leaders in Latin America on reproductive health for youth, they always bring up to the table this reflection. Mm-hmm. So we call it friendly services. Wouldn't all friendly or services should be friendly? Mm-hmm. So we use alternatively use adapted services. So yeah, I personally think that that we should use a different word. But it's taking time for people, both in our side as clinical providers and the same Ministry of Health. So, but that's a good question. And about what is a friendly service and what do you think about what this friendly service should look like? We share the checklist of a friendly service or an adapted service for youth scientists from the IPCF framework. But in fact, in some of the countries, the youth that we have invited to these interventions, they are already participating in the validation of this checklist. So I think another aspect that came in the last workshop was that a friendly service or an adapted for youth service doesn't necessarily mean or should mean that it is the service from Ministry of Health. Mm-hmm. It could be a pharmacy that has that has all the products or the product that this young boy or young girl wants, and that it is given by a more professional pharmacist. So we haven't had time to in our workshops to go deep into these details, but I understand that they are important, especially if we want to make contraceptives available to other services, to services that are going to be more accessible to this age group.
Mm-hmm.
Mm-hmm.
Hello, can anybody hear me now?
Hello, is this Yuan?
Yes, are you hearing me clearly?
Yes, that's great.
Yes.
Okay.
Sorry for the challenge with communication. I was introduced, my name is Ruben Esiel. I work for Action Health Incorporated in Lagos, Nigeria. An organization I co-founded with my partner and wife, Nika Esiel. We've been working mainly to promote access of young people of Nigeria to youth-friendly sexual and reproductive health information and services. And we have over 20 years of experience in marketing youth-friendly health services. We have a model or learning facility in our youth center where we train both nurses and doctors and other levels of healthcare providers to provide youth-friendly health services. And basically what we try to do is to get adult service providers to understand that it is not about what adults want for young people, but it's about what young people want for themselves. And whereas in the first 15 years of our work with youth-friendly health services, we are focused more on in-school young people. In the last 3 to 5 years, we have done more work with out-of-school young people. And one of the key findings in that regard is that the out-of-school young people are more diverse than we have ever thought. And presently, we are working with out-of-school adolescent girls living in urban slums in Lagos. And we have had a research in one of the slums called the Wire with a population of about 500,000 to about 1 million people. And the findings are very staggering. We realize that quite a significant number of out-of-school adolescent girls have never been to school, therefore they can neither read nor write in English language. Their basic sense of numeracy is very poor, and we realize that there is a generational correlate with the level of ignorance that pervades with these young people. Then when it comes more closely to the issues of their sexual and reproductive health, findings showed that quite a number of these young girls are more sexually active than the average age of about 15 to 16 years in the general population, and that they have more multiple sex partners because of several reasons, including poverty, gender-based violence, sexual abuse, and those kind of structural things that affect them. Therefore, in promoting access to youth-friendly health services, it is very clear to us that there is no one-size-fits-all, and therefore we need to target these young people where they are, realizing their context, and then taking into consideration the fact that we live in a society where there is a lot of hypocrisy around the issues of sexuality. People see a lot of sexual activities going on, even with young people, but pretend as if what they are seeing is not true or real. And this creates the bigger challenge when it comes to advocacy and using evidence. In terms of the evidence, one thing is very clear. the NDHS has continued to show to us that more and more young people are getting sexually active, and that with the new HIV infections coming up more amongst adolescents and young people, that we need to do something. However, there is a strong resistance by the religious groups to ensuring that access, even when it is provided for in the policy, in reality is a little difficult. So what are we doing differently in Action Health? What we are trying to do differently in Action Health right now is to see how we can involve young people more in advocating for access to services. But you know, that also has a major challenge. And the major challenge is that young people are very mobile, they are achievement focused, and they are into doing their own things. And they then believe that if you choose to be cool, you need to be cool about resolving your issues. And therefore, as they move on the trajectory of life, to stay on and do this work on a very continuing basis with them becomes a challenge. I think in a nutshell, this is what I want to contribute at this point, except if anybody has any specific questions. Oh yes, before I round up, the issues of social media. Yes, this is catching on rapidly, as you know that the use of mobile phones in Nigeria has gone up so tremendously. But then we are not having as many youth-friendly sites that we can begin to introduce young people to. And even though some places say they are youth-friendly, the challenge is they are youth-friendly to the extent that they want to talk about abstinence only, not in providing commodities. Thank you.
Thank you very much indeed. I'm very happy you were able to join us eventually. It's a very interesting story to hear. Relating back to the previous discussion, you have a very clear market segment, so to speak, of young girls living in very hard settings in urban Nigeria. I'm wondering we have a very long list of participants on the phone here. Are others working in similar environments? Does anyone else on the line have any experiences of working with this population that they'd like to share as well to see how their experiences compare with the experiences that Durham has just talked to us about?
Hello?
Hello, yes.
I rather have a question to the presenters because we are talking about marketing to youth, and several times we heard about advocacy, and I just wanted to know more about the strategies people are developing, because when we talk about advocacy, we mainly mean just targeting these decision makers, such as maybe program managers, some policy leaders, to make this policy more friendly to the youth getting to the services. So when the presenters talk about involving youth in advocacy, so which role do these young people play? And also along with, let's say, advocacy activities, when just, marketing to youth, what about using that strategy that is called, let's say, behavior change communication? Thank you very much.
Thank you, Badar. That's a very good question. As you say, advocacy is usually thought of as reaching senior decision makers and so on. And so it'd be interesting to hear from perhaps Uem first. Hello,
Hello, is there a Ms. Paloma? If you can please mute your line, please put yourself on mute.
I don't think we're going to hear from OM again. Sounds like there's another problem. I noticed that earlier Numfumunte had asked to speak. Numfu, if you're there, would you like to ask your question or make your comment?
Yeah. Can you get me? Hello?
Please go ahead, we can hear you.
Can you get me?
Yes, please speak.
Oh, okay. All right. Thank you for giving me the opportunity. Actually, it's Numpo from Cameroon, precisely Cameroon Agenda of Sustainable Development. I've been following the conversation. It's wonderful, especially the presentation from my mentor, Dana, of Women Deliver. Thank you for all the presentation. One key thing I realized in the whole discussion is how to make the services friendly for the young people. That is where the problem has always been. How friendly are the services we provide to young people, be it education, be it product delivery or whatever. So marketing to young people, we must be able to understand that obstacle of friendliness. And I would like to appreciate the project in Uganda presented by Jana. I think it's one of the strategies to take out education from the regular to the young people, which is one of the systems. You bring the services that you take them to the young people and not expecting the young people to come for services. And in that case, it's good. But my preoccupation at this point is how to bridge the gap between delivering education to the young people, taking educational services to the young people, and helping the young people actually buy into the commodities, which is the end product of digital change. If they learn about all these things and don't have the reproductive, the family planning commodities, then we have not achieved anything, because maternal death will still keep increasing, and child mortality from such pregnancies will also keep mounting. So I was thinking, how can we take these services, that is the family planning services, like education, to the field, just like we take education to the young people down to where they are? How can we do that precisely? And how can we make sure that the gap between education and acquisition or access to the services is very limited? Because young people change too often. If you have education in the morning and can't see the services by evening, you will forget by tomorrow morning, and we'll keep doing the same things over and over, but before they realize it, they're already pregnant. So we must try to limit this gap. How can we merge this gap and make sure that when the young people receive the education, they find access to the services in the same location where they are not actually going to a referral service, which we have done in the past and it failed? How can they just get the services at the same point and make the choice immediately? That's the kind of thing I want us to brainstorm on. Thank you.
Thanks very much, Numfu. We have two other comments, and then maybe we can take the three of them together. Annabella and then Elizabeth Wesley.
More than a comment, I would like to respond to some of the last questions, but if you are going to gather more questions, I will wait.
Okay, thanks. Elizabeth, did you have a question, or is it a response? Go ahead, Elizabeth.
Oh, sorry. Can you hear me?
Yeah.
Okay, good. This just a comment on the role of pharmacies. I know Annabella mentioned pharmacies, and I know pharmacies are also very popular with young people in Nigeria. And I think it's just important to keep pharmacies sort of in our sites as very popular sort of delivery sites for young people because of the anonymity and the privacy and the speed. But it's also challenging because pharmacists don't necessarily see their role as so educational. So I wondered if, I know Annabella already mentioned that there's some discussion of pharmacies in her work in Latin America, but if other people have insights about how young people seek services in pharmacies.
Thank you. And then we also have a question from Moses, and then we'll open up for responses. Well, and then we'll have go back to Annabella, and then have some wrap-up comments. So Moses, do you want to go ahead, please?
Thank you, Askira. I like this representation, and more especially, I'm thrilled by the event presentation. And I like Jenna's conceptualization of this, and also Judy, the connection between the marketing and the youth corners, and as well as the shops, the pharmacies. In most of the rural areas, you don't have the shops, you don't have the pharmacies. And the only potential areas the youth can access contraceptives would be through the youth corners that are established near the small healthcare systems. So I would like us to be mindful of that link. We go to the rural areas where services are not there to be able to think of how to link the youth corners with the promotions that we carry out for the youth. Thank you, Ethan.
Thank you. Annabella, did you want to respond to Badara? And then I think we can ask for some feedback on the comments from Moses and Nunfa.
Hello. In terms of one of the questions of Badara, what is the role of the youth leaders in terms of advocacy? I will give you one concrete example of what we have looking for after the regional workshops that we've done in Latin America. For example, one of the criteria to invite youth was that since we knew that there was higher unmet need among youth in rural areas and in the lowest quintile, we wanted to make sure that youth participants were from rural areas, youth leaders that are already working in their communities and not at the national level. So by doing that, in Nicaragua, we invited two youth leaders, and they, during one of the first workshops, they said that the Ministry of Health had closed their clinic especially targeting youth. And when they came back, they were clear that they needed to meet with the local area director, regional director. They did that, and they didn't get any response, so they continued their efforts to go higher in the Ministry of Health, and they went to meet with Director of Reproductive Health in the Central Office of Youth for Ministry of Health. They haven't reopened the clinic, but they are in the process to be part of the validation of the checklist of what should youth-friendly sites look like, and after that, they want to make like a proposal to reopen the Ministry of Health clinic that will target youth, especially those that are already that some of them are already have a pregnancy. So that's a concrete example of how the youth leaders have been involved. And in terms of the last question, I don't remember his name. He was saying that pharmacy it's not necessarily the right supply chain or service delivery sites for youth in rural areas, and that's true. And one of the strategies of our intervention has been to also try to make sure that these community leaders that provide education, information, and dissemination of the importance of family planning and contraception can also be seen as the ones that can provide the contraceptives to other youth. So that is more possible than looking at the pharmacies if we want to target those youth in the poorer areas and rural indigenous populations.
Thanks very much, Annabella. While you were speaking, we had a request from Ajito to ask if anyone, either of the speakers or anyone else from the group, has got any thoughts on strategies for involving youth in advocacy around religious issues. And in many of these countries that we're considering here, religion plays a major role. And does anyone have any concrete experiences of involving youth positively in addressing concerns from religious groups?
Hi, this is Jana from Women Deliver. Can you hear me?
Yeah, go ahead, Jana. Yeah.
I'm actually going to ask Numpur to comment on this. Numpur, why don't you talk about some of the work that you're looking at doing with traditional and religious leaders?
Okay, Jana. Yeah, if you want me to comment on it, I think we are looking at the perspective that these traditional leaders have power at the grassroots. Thank you for the opportunity once more. And I just wanted to know that I'm one of the 100 young people who've been delivering the opportunity around the world, and we are doing mightily. And the project, the traditional rulers, adolescent pregnancy, traditional rulers stay out. We are trying to see that the traditional rulers actually engage in the promotion of adolescent sexual and reproductive health rights, because these traditional rulers still have power, especially in Africa. Democracy has come into place, and most people think that democracy has overshadowed the traditional African society, but that is not the case. We still have very strong respect for these persons, and it's good we engage them to speak out, because their words are like laws. They don't need to validate them in parliament, but they become a culture of the people and the tradition. So if we shift their paradigm to start supporting adolescent reproductive health rights, then obviously the community will change, and a lot of things will happen. There will be a leverage for other marketing programs to gain programs, easy access to the young people, and impact will be very memorable, especially as this has changed the grassroots. I hope with a limited time that's enough.
Thank you very much, Lynn, for that. That's very helpful. I just wanted, we only have a few minutes left, but I was just wondering whether Uem has any experience in that particular area, given that he was the one that first raised the issue of involving youth in advocacy activities. Uem, do you have anything to share on involvement with youth groups, with religious groups?
Yeah, can you hear me?
Yes, clear. Yeah.
Can you hear me?
Yes, go ahead, please.
What I have to say about involving youth in advocacy is that we must also work with the youth to understand what the issues are. Because part of the key challenges they face is they are really not experts. They are who they are, young people. They are experts in youth issues, but they are not experts in the technical issues that affect the young people. And therefore, we need to learn to work with them and not to expect too much out of them, but to expect to the limit that their capacity has been built. That is number one. Number two is that in the process of working with youth advocates, one of the things we learned is that they are very good mobilizers of their colleagues, and therefore they help to increase the base of the young people who understand the issues and who can speak in favor. The third is that we also have to help them with values clarification. As you know, the debate on sexual and reproductive health is so wide and far apart, and it touches on some perceived religious and moral values in certain respects. And therefore, if we help young people to clarify their values, it helps in the process. But by and large, I think that is the way we will have to go. Youth participation in advocacy and service delivery will be key to ensuring access to youth-friendly health services, not necessarily expert provision of services. Thank you.
Thank you very much. We've now reached the 1 hour point, so we should be wrapping up. It's been a very broad-ranging discussion, and I think this reflects the fact that when we look at reaching from a marketing perspective, it opens up different ways of thinking through both identifying how you can work with you from this perspective and ways of working with you that really brings home the importance of first segmenting the audience and understanding them more thoroughly that way, and then ensuring that whichever approach you take follows that segmentation, that you do distinguish between adolescent girls, adolescent boys, those living in slum situations, those more fortunate, those in an education outside, and so on. And we also heard a little bit more about how youth can become advocates. We heard how youth can access private sector facilities. And so all in all, I'd like to thank everyone for their contributions. And unless there are any last-minute comments or inputs, we'll wrap up now. So just finally, does anyone have any closing words of wisdom for the group? If not, well, thank you all very much indeed, and we look forward to continuing the discussions offline, and also to invite you to the next webinar that the NDA will be hosting, I think, next month sometime. So thanks very much to everyone, and have a good rest of the day wherever you are. Thank you. Bye-bye.